Jewish Education in Media is pleased to present L'Chaim, a program that highlights the people, issues, and events of importance to the Jewish community. Now here is your host, Rabbi Mark Golub.
I'm Mark Golub, and there are a few iconic names of Israeli institutions and organizations, names which everyone knows and which tend to evoke enormous Jewish respect and Jewish pride. And foremost among those iconic names is Hadassah Hospital, which of course has been a major presence, first in pre-state Palestine and in Israel today. Actually, Hadassah Hospital in Jerusalem, funded by the Rothschild family back in 1918, has evolved into the Hadassah University Medical Center and includes two university hospitals in Jerusalem, located most famously on Mount Scopus and in Ein Kerem, with 1,000 beds and 31 operating rooms, 9 specially oriented intensive care units, an extensive network of community-based services, and 5 schools led by a superb group of medical professionals operating in collaboration with Hebrew University. And some of the most cutting-edge research in the world is being done by the fabulous men and women at Hadassah University Medical Center, so that Hadassah has been responsible for medical breakthroughs in 3 critical areas: ALS, melanoma, and macular degeneration. And lucky us, I'm so pleased to be able to welcome to L'Chaim Hadassah's head of research and development, Dr. Eyal Mishani. And Eyal is also a professor of nuclear medicine at Hadassah and is the director of Hadassah's cyclotron radiochemistry facility. And also joining us is Dr. Janice Weinman, Executive Director and CEO of Hadassah. And Eyal and Janice, it is so wonderful to have you at this table. Thank you for joining us.
Thank you.
And I told both of you, first of all, I'm a huge beneficiary of medicine in Israel, and I have long been a fan of Hadassah Hospital. We spoke about some of the people I've had a chance to interview on L'Chaim. But it's wonderful having the two of you, and there's just so much I want to talk to you about Hadassah and what you're doing now. And Eyal, it sounds like the work that is being done in research at Hadassah has been extraordinary. And I'll say this, I'm sure, at the end as well, but I thank you for the contribution you and your colleagues are making. I want to learn a little bit about the two of you, then I want to talk about your work. And I start with you, Eyal. Where were you born?
Well, I was born in Israel, and all my studies I did in Israel, in Tel Aviv University.
You're a Sabra.
Yes,
Uh-huh.
and also my parents.
So you're a second generation?
Yes.
Where are your parents from?
My parents from Jerusalem, and they moved to Tel Aviv when they just got married, and I moved back to Jerusalem when I got married.
That is wonderful. But they were born in Jerusalem?
They were born in Jerusalem.
Where did their parents come from?
Syria.
Syria.
Yeah.
Fabulous. It's interesting. There is this, this myth that we just arrived last year, and here you go, really more than 2 generations back, so it's wonderful. When you grew up in Israel, and you said you grew up in Tel Aviv and then you moved back to Jerusalem, did you know you wanted to go into the field of, in some way related to medicine?
Yes, I knew it when I was 16.
How did that happen, Eyal?
Well, I was a bad student in high school, and I had a very good teacher to chemistry and physics when I was 16. And I think that after the first class, I decided that that's what I'm going to do with my life, science. So then I had a break of 4 years in the army, but I was precise. I knew that I'm going to go to the university and learn chemistry and physics.
And you've enjoyed it ever since?
Oh, very much.
That's lovely. And did I understand, did you ever come to America to study?
Oh yeah, when I finished my PhD in Tel Aviv University, I did my postdoc 2 years in Washington University in St. Louis in the field of molecular imaging. Actually, the origin of positron emission tomography is in St. Louis in Washington University in Barnes Hospital. They built the first cyclotron in 1967.
Amazing.
And I joined the group. And then I came back to Jerusalem, to Hadassah, to establish the first cyclotron radiochemistry facility in Israel.
And for any in our audience who do not know what a cyclotron is, what is it?
It's an accelerator, a device that we produce radioactive isotope or medical radioactive isotope for peace purposes, health purposes, and we tag biological molecule to do molecular imaging, to diagnose cancer, to diagnose brain diseases such as Alzheimer, Parkinson.
All right, I'm going to come back in a moment and pick up the story there, but I just want to talk to Janice for a moment. So you're CEO of Hadassah, oh boy. What's your Jewish background, and how do you end up in this line of work?
So I was born in London as the child of Holocaust survivors. We came to America.
How old were you when you came?
I was 4 years old. And my whole life, actually, I've been raised in an environment in which not only have we been committed to the religion that I practice, but also to Zionism and to the practice of supporting Israel in all its forms and throughout its history.
Talk for one more moment about that. What about your parents and your upbringing instilled in you this love of Israel and a Zionist fervor?
I think my parents were deep Zionists. Their experiences during the Second World War made them appreciate the value of our own homeland, made us really understand that the future lies so much among our own people, that the opportunity to grow our own culture and our own values and to continue them in the land of Israel is something that we need to fight for continually. Hadassah, for me, is the culmination of that, feeling those values, that experience, because it is an organization that not only supports financially, but through its commitment, through its advocacy, through its work throughout the country here in the United States. It really is the culmination of the expression of Zionism and relating it to us as being American citizens as well.
That's lovely. Where were your parents during the Holocaust?
My father was in the army, the Czech army, which became the French army and then the English army. My mother went through various stages and ended up in London, and that's where they met, and that's where I was born.
That's lovely. We were talking off camera before we began. You speak 4 languages, but you said your parents speak 7.
Spoke 7.
Spoke 7 languages. Does this reflect, it has to reflect to some degree on their intelligence and their education. I assume in some way their value of education was imparted to you as their daughter, correct?
Yes, it was imparted to me as their daughter, but also their experiences contributed to their knowledge of languages because they migrated so many times during the war. Also, I think that Jewish education, in many respects, is what has held us together and made us understand the value of the land of Israel, manifested in Zionism and manifested in the way in which we can practice our Jewish values. I think that was very much the culture in which not only I grew up in, but in the way our generation grew up, really respecting the practical Zionism and the practical manifestation of Judaism, as Henrietta Zold said, practical Zionism.
In case anyone forgets, Henrietta Zold is the one who founded Hadassah. You have had yourself a very impressive sort of professional journey as a woman who's done many, many things, culminating now in your role as CEO of Hadassah. And you have a doctorate of your own from Harvard, and you've been able to make major contributions. And yet I somehow feel that much of where you were always meant to be is where you are now, And I don't want to, I don't want to over-romanticize it, but in some sense, I think you feel that what you're doing now is of special importance. Am I correct?
You're absolutely correct. I've been fortunate to have many wonderful professional experiences and volunteer experiences, and I feel that they've all come together in my work at Hadassah. It is an organization that is deeply, deeply committed to the land of Israel. It's an organization that is deeply committed to empowering women. It's an organization that believes in the value of relationships and communities as well as abroad. And so it is really, it is an organization that not only captures but builds on the strengths of the members, of our 330,000 members, as well as the strengths of the country of Israel.
Mm-hmm. Beautifully said. Eyal, although this is off topic, meaning we're not talking about Hadassah or medicine or research, here you are an Israeli, and you're a second generation Israeli, second generation basically out of Jerusalem, and you come to America and you meet someone like Janice, and you meet the people who are American Jews, excited about Zionism, excited about Israel, and in this particular case, excited about supporting your work and the work of Hadassah Hospital. I wondered just how you as an Israeli react to someone like Janice and her story. And, again, I'm not looking for anything Disney-esque here, but I would be interested to know the extent to which the American Jew is in some way affirming for you of, Klal Yisrael and the connection between American Jewry and the State of Israel.
So first, I feel I'm thankful. I mean, to get the support that we get from the Jewish in the United States or all over the world, and especially from the HWZOA, I think that we are fortunate to have them. And without them, we couldn't do what we are doing. And we need them. Absolutely, we need them every day.
Mm-hmm. Do you have a family?
Oh, yeah.
Oh, yes. What's your family?
I have a son in the Army now. He's an officer in the Army. My daughter, she just discharged from the Army. She was also officer in the Army.
Wow. Do they know what they're going to do?
Well, my daughter is going to start university in this October. She's going to do engineering.
Very lovely.
And my son didn't decide yet. He's a soldier.
Okay, all right. Well, the two of you are representative of something very special in the Jewish world, American Jewry, Israeli Jewry, and what you're doing, with yourselves and your families is really, really wonderful. Did I ask you on camera what your daughter's doing?
No, you did not.
We talked about it beforehand, but you should mention, what's your daughter doing?
Well, my daughter, first and foremost, is a mother of two little ones.
Mazal Tov.
Thank you. And my daughter is also the president of AT&T for New York State. And she's also on the board of Jewish organizations.
Yes, I asked you if she has a Jewish neshama. You
Yes.
said absolutely, right?
Thank God she does.
That's lovely. It's a sort of a different kind of question for an Israeli. And in some way it's unfair to the Israeli, because there are Jews who assume, well, if you're an Israeli, then obviously you have a Jewish neshama. But when you talk about a Jewish soul, you're talking about a feature of personality, where it's not simply, I happen to live in a Hebrew-speaking country that happens to be in the Middle East, but that I have a feel for the sweep of Jewish history and the tie that binds Jews, no matter where they are on the face of the earth. And there are some Israelis who have grown up wholly secular, for whom those feelings are alien. And so I'm asking you, Eyal, where do you and your family fit in that spectrum?
Well, I think, we are not religious. We follow, of course, the Jewish tradition, the Jewish culture. Every Friday evening we have the dinner together.
You have a Shabbat in some way.
Oh, absolutely.
You understand that already is much more observant than the vast majority of American Jews. And I know Israelis say all the time, well, I'm really secular. But what secular means in the Israeli context is very different than what secular means in the American context. And I'm sure you do something for Seder?
Oh, absolutely. Yeah.
Absolutely. Yeah. So there is a feel for the Jewish people, and really that's what I was asking you. And for me, it's not a matter of observance. It's a question of to what extent does an Israeli feel that he is part of something larger, the Jewish people, and that has been true for you.
Oh, yeah.
Do your children have the same perspective?
You know, it's funny because I think last year I decided to go for the Passover, just to go for a vacation to Europe somewhere. And my daughter and my son insist that we will stay in Israel with the family, with the larger family, and have the Seder together, all of us. So we are a very big family. I have 2 sisters and the family of my brother who passed away 2 years ago. So every Rosh Hashanah and Passover, we meet together and we have the traditional dinner with reading the
How many people
Haggadah.
there?
About 30.
Wonderful. That's marvelous. I'm sorry that your brother passed away. How old was he?
He was 68.
68. What did he die of?
He had COPD.
What is that?
He had kind of lung disease.
Well, I'm very sorry. Your stories are really wonderful. You have Passover?
Oh, sure.
How many people?
Around 18.
A
It's small in
nice side
comparison.
Seder, but it doesn't compare to 30. Very, 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 very nice. Well, it is so lovely to hear the stories you both tell. So I want to now talk about some of the things that are going on in the research end of Hadassah Medical Center. And you are the head of research, and you heard me say that as we prepared for this program, I saw that there were 3 areas of medical, what I said breakthrough, I don't know if that's a fair description, that seemed to jump out. And one was on with ALS, which in America, you know, is known as Lou Gehrig's disease, because the Yankee great ball player who had ALS, in common parlance here in America, it's always associated with him. And then there was macular degeneration, and there was one other thing that I mentioned, melanoma, which is cancer of the skin. Is that correct?
Yes.
Okay. So first of all, is it correct to say that the research that's been done at Hadassah has really contributed in those 3 areas?
Yes, I think that we have conducted one of the first clinical trials, phase 1, in Hadassah in the field of ALS and MS, and we are going to start a phase 1 clinical study in macular degeneration. But I think when you mention all these 3 diseases or field, I think it's the tip of the iceberg of what we do in Hadassah.
Please, describe more of it.
Well, let me start first by describing the research structure in Hadassah. I think that what is unique in Hadassah Research Hospital Center is that we do translational medicine for many years, more than 12 years now. And when I say translational medicine, I mean that we do the basic research on the bench, starting with cells, starting with in vitro studies, and then we have the knowledge to translate it into treatment. And fortunately, we already did stuff starting again with cell study, which ended up as therapy in Hadassah and in other hospitals in the world, in the field of molecular imaging, diagnosis of cancer, in the field of orthopedics, in the field of neurology. So I think that if you would ask me what is unique about Hadassah, is that we have the whole umbrella. We start with preclinical, and we ended up in successful cases in clinical practice.
To what extent are you, as somebody who sees the research being done all the time, optimistic that there will be practical results that will enable people to live longer and healthier lives?
Well, it happens all the time. I mean, if you look back 100 years ago, people lived, the average age was 60 or 50. And now I think in Israel, I know that it's 84 for women and 82 for men. Just imagine to yourself, if you would ask someone 60 years ago, he wouldn't believe that. So we are progressing with the time. We do step by step. And I think that the life quality and it's much better now.
Mm-hmm. Is Hadassah doing anything in the field of Parkinson's disease?
Yes, we do. I mean, we have a very active neurology department. There are kind of treatments which they are done also in other places, but we are one of the leaders in Parkinson's disease in Israel, at least.
Mm-hmm. You know, I'm a layperson, and the audience watching you now all over America on JBS, the majority of us, the vast majority of us, are lay people, and therefore medical jargon and medical insight is something that we can't bring to the discussion. So the question I'm about to ask you, I'm asking you to give me as lay, in lay terms, as much as you can. When you, as a researcher, and the people who work with you and under you, are trying to find the cause of some of the most hideous diseases that afflict society today, and you know, there have been enormous strides in areas of cancer, and there are still some cancers which seem to be eluding any kind of effective long-term treatment. What is the biggest challenge that the researcher faces? What is it that you're trying to do? You know, that you wake up in the morning, you and your colleagues, and you're trying to find an answer that will lead you to some conclusion that will have a practical effect on how healthy we are and how long we live. And there is an orientation that you have which we don't even understand. I'm asking you, Eyal, to the extent to which you can express it in terms that I'm going to understand and our audience understand. When you get up in the morning, you and your colleagues, what's the driving goal for you?
Well, the driving goal is to understand the mechanism of the disease. And I think once you realize that similar to life is dynamic, and cancer cells and cancer is dynamic. So it starts in one form and then it continues in other form. For example, when we understand the mechanism of action of proliferation of cancer cell, and you come up with a target and you hit the target and you can shut off the target, and then suddenly there are mutations that bypass this pathway. So I think that this is the major challenge. So when we wake up in the morning every day, we try to first understand what is going on, what is the mechanism, how it behaves, and we try to give answers which will be not too specific, but can hit many targets as possible in order to cure cancer.
Mm-hmm. Are you familiar with the work of Dr. Michael Lotem at Hadassah?
Yes.
Who's working on basically cancer immunotherapy.
Immunotherapy, yeah.
And what I've read is that she is using tumor cells from the patient to create a vaccine for the patient that is then injected into the patient, and that it creates a higher survival rate. Can you explain to us what's the theory there, and how, you know, tell us any part of that, what sounds like a fabulous story.
So if you take cancer cell and you take the cancer cell, it's personalized vaccines. You take cancer cells from the patient itself and you try and you shut off all the systems inside the cells and you inject the cells back into the human body, into the same patient, then you increase the immune system of the patient. And by that, the body is being able to combat cancer much faster.
Mm-hmm. And you have seen that there are efficacious results here, yes?
Yes, actually she did more than 200 melanoma patients successfully, and we saw that the vaccine is safe and effective.
That is fabulous. Talk to me about the case of the macular degeneration, which means that you're losing your vision, correct?
Yes.
Okay, and the work was done by Professor Eyal Mishani?
Yes.
Okay, what's the story there?
So, actually it's a long story. I think that it started with the work of Professor Ben Rubinoff, who developed the way to isolate embryonic stem cell. And then they took it further, Eyal Banin took it further, and actually he's going to start phase 1 clinical studies in Hadassah next month. He already got the FDA approval for that. So they inject embryonic stem cells into the eye, and then the embryonic stem cells develop the eye, the regular cells that help the patient visualize much better. And again, the clinical studies are going to start in the coming weeks.
Why, if he's in Israel, do you mention the FDA?
Well, when we start a project, we think worldwide. We think how can the Hadassah researcher can contribute, of course, to Israel, but also to humanity. Mm-hmm. So if we have something in hand which we believe that can contribute to the treatment of patients, we think worldwide.
You also mentioned stem cell research, and there is a wonderful Jewish woman in where I come from in Stamford, Connecticut, Roz Goldstein, who has done enormous philanthropic work in funding stem cell research. And Eyal, I seem to read that there are many physicians and many researchers who believe stem cell research may be the key to being able to combat many of the diseases which afflict us today. Can you talk for one moment about stem cell research in general as it is being either studied or used in Israel?
Well, yes, you're right. I think that the approach of using stem cells to combat many diseases, it has a lot of potential. The idea is to use the stem cells and to implant the stem cells in organs which you would like to regenerate the activity. And then when you inject the stem cells, they start to grow as typically cells belonging to the organ and start the whole biochemical mechanism to produce either enzymes or other components which are important to the activity of the organ. So you can apply it in neurology, you can apply it in other diseases, also in orthopedics, and there is a project that we already started in Hadassah using stem cells to in application of orthopedics.
That's wonderful. In America, there was some controversy about stem cell research because the question is, where do you get the stem cells? And do you get them from either embryonics? Do you get them from aborted fetuses? In Israel, is it a controversial issue?
No, actually, when we start clinical studies, we need to apply to get the approval from the health ministry or from Helsinki committee. And in the last 1 year, we applied at least for 2 or 3 applications to use stem cells without any hurdles.
Fascinating.
Could I just interject
Sure.
here, if you don't mind? When stem cell research was as great an issue, controversial an issue, under a particular administration here in the United States, Hadassah was the organization, HWZOA, the Women's Zionist Organization of America, to mobilize our membership and beyond in a program we called Take a Stand, where we were at the forefront of advocacy on behalf of doing stem cell research in the United States.
Good for you.
We do that all the time. Mm-hmm. That is how we in part support the research that occurs in Israel. We not only do it financially, and we not only do it administratively or through the governance role we play, but we play a very strong supporting role in terms of the research that is done. And that was a perfect example where we were at the head of the country in making the importance known of doing stem cell research.
No, I did not know that, and that's thrilling. And, you know, in the Jewish tradition, stem cell research would be a primary Jewish value. And the opportunity to extend life and to give health to people who are already living, there is no greater Jewish mitzvah. And so I am very happy to hear you tell the story about Hadassah, and I think the work you're doing is fabulous. I want to ask you a couple more questions about where medicine is in Israel. Tell me about Alzheimer's. Again, in America and in the American Jewish community, the number of families who are dealing with Alzheimer's, it seems just to be mushrooming. And it is such a horrible disease because someone you love is right there, and very often they are physically still really intact. And even if they begin to decline, their physical decline is nowhere near what has happened to them in terms of their mind, and their mind is not there, and they don't know who their loved ones are, and they can't remember, and they become paranoid, and they hallucinate. And here, people, that's still my mommy and my daddy and I love them, and yet at the same time they're really not there. So there's a real effort to do as much as possible to find. I mean, the word that's always used is a cure. But anything that even slows the process down is a major contribution to any family with a member that has Alzheimer's. So can you tell us if anything is being done at Hadassah, or if you know of anything in general in Israel? And we are, on the one hand, I do want to put the spotlight on Hadassah, but one of the things I am also hoping you'll tell us is Hadassah is one of a series of extraordinary medical institutions in Israel, and I want to know what's happening in general in medicine in Israel. But right now, what about Hadassah and work on Alzheimer's?
Well, unfortunately, we don't have any breakthrough in the field of Alzheimer. We still struggle with to understand. We know the mechanism, we know the amyloid plaques which are formed in the brain.
What's the mechanism?
So we know that there is a kind of enzyme which is excreted from the cells and create the amyloid plaques in the brain, which just goes to the damage. Now, we're still struggling with the imaging of Alzheimer's disease non-invasively with nuclear medicine methodology. But unfortunately, I cannot say that we had any kind of breakthrough in Hadassah that we can say we can treat.
Okay, but you're working on it all the time, aren't you?
We do. We still do some work in order to understand the mechanism, to evaluate the potential drugs which might attack the amyloid plaques in the brain, but we don't have any running clinical studies which show positive results.
Okay. Is Alzheimer's an issue in Israel? Is it a problem?
Like any other place in the world.
Okay. And what about organ transplants, Eyal? And in America, there are more and more wonders being done all the time. And there are people who receive organs and then go on to live long lives. And it's interesting, again, in terms of Jewish values, it always seems to me that one of the mitzvot that should drive Jews everywhere in the world is that if something happens to one tragically, but that in one's own passing, one could donate an organ to a living person, which would extend this living person's life. It seems to me that it's an absolute obligation of the Jew to do so. And Israel has had less of a moral issue with organ transplants than the United States has. But I'd like to know in general, number one, where do you feel the whole field of organ transplants is now at Hadassah and Israel in general? And I want to know the extent to which there are still lines and lines of people waiting for organ transplants who tragically may never get them in Israel.
So actually this is more of a clinical subject which I do not deal in Hadassah now.
Okay.
Which is not related so much to the research. But I know that there is a national project of organ transplant, and Hadassah, of course, is part of it. There are only a few major hospitals in Israel which are doing it. We do liver, we do kidney. Successfully, we have well-trained people in Hadassah to do it. But again, this is more clinical. And
Fair enough.
And I want you to know that Hadassah was the had the first organ transplant unit in the state of Israel.
Marvelous. Where?
some-
Where? Which one? Do you know where it was
I'm
located?
not sure which one,
Okay,
but
doesn't
it was
matter.
the first.
That is lovely to very lovely to know. Your training is not as a physician itself. How does the fact that you're not a physician either help you, or does it ever in some way handicap you in terms of the research you're doing?
Well, I think it helped me because I was educated as a basic researcher. So to be a good researcher means you have to have the curiosity, you have to have the patience, and you have to have the passion to discover, to understand what is going on. And so I trained as a chemist, but when I was in the States, I did the shift and I started to do biochemistry and medical imaging. And I think when you deal with basic science, chemistry, imaging, you can see the whole picture. I mean, when I think, I'm not thinking as disease-oriented, but technology-oriented. For example, when people talk to me about stem cells, well, I look at stem cell in general as a technology, not in a specific application in one disease, neurology or macular degeneration or orthopedics. I see it as a whole. So I think that this is an advantage. Now, luckily enough, I'm in a hospital which, the prestigious hospital in Israel who cure people every day. And as you said, we see more than 300,000 patients a year. So I have collaborators in the hospital. So the process is go talk to the doctor and see what are the hurdles, what is the challenge, and try to come with an answer. Do it in the lab, and then try to translate it into the clinical phase. So, and I think that, again, this is very unique in Hadassah to have PhDs coming from the different world of science, put them together with the physician who treat people, and then you can come up with answers.
Marvelous. That's a wonderful answer. Thank you. Do you have enough money? Because research is dependent upon the budget. We've talked about your children. I'm very proud of my daughter. My daughter is doing some fabulous work at Hunter, and she gets NIH grants, huge grants, to do some very important research. And again, I'm very proud of her. But I have seen from behind her eyes the importance of the grant, because without the money, you can't do the work. And so I want to know, the work you're doing is so important, Eyal. But what about the funding? And to what extent, first of all, is that your headache?
Oh.
And then, yes, that's right. And then tell me what the situation is in Israel, because Israel doesn't have unlimited funds. And so I want to know the MS here. What's the real truth about funding the research that you want to do?
Okay, so first, we never have enough money, never. Now, fortunately, we can compete on grant monies inside Israel and also in the United States and also in Europe. So if we take the whole budget of research in Hadassah, I think that at least 35 or 40% are coming from competitive grant application, which were submitted from Hadassah researchers. Fortunately, we are supported by the HWZOA. So if you look throughout the years, the resources that came into Hadassah, which were specifically to research, it's huge amount of money. And without that money, we would not be able to be where we are. We established the cyclotron facility and the first radiopharmacy in Israel. We established the animal model house, which is very unique in Israel. The large animal surgery room, thanks to the donation that we got from the HWZOA. And there are so many...
What is that?
The large animal... So this is very unique. When you do the translational medicine, as I mentioned before, you start with cell study, and then you move on to small animal. And then if you really want to see, if you do something in a larger animal, which is a little bit closer, depends on which organ you're working, but when it's closer to human, you would like to do some studies in larger animals. So we have state-of-the-art larger animal surgery facility.
Where you can do trials on
where
larger
you can
animals.
oh, yes.
And this is essential before you move to literal human beings.
Not always, but in most cases it's essential. And it gives you much more information before penetrating to the phase 1 or other phases of clinical studies. We have a state-of-the-art genomic department. So again, we never have enough, but fortunately we are supported by the HWZOA, which help us to, when you compete on competitive grant money, you get money specifically for a certain project. You cannot use this money to build the infrastructure. When you think about infrastructure, you need someone to support you.
On the one hand, there's never enough money. On the other hand, you're fortunate to have the money you have, and it is significant.
It is significant.
Okay. So Janice,
Yes.
you're CEO of Hadassah.
Yes.
And I want to ask you the same question from a different perspective. Part of your role is to make sure that Eyal and his department have the necessary funds. So, first of all, there's no way I can have you here without asking you to comment on a story which really goes back about a year. But there were reports that Hadassah was living with annually a significant deficit, something like $350 million. You were down every single year. And it's one thing for it to be down 1 year, but if this was an ongoing problem that Hadassah faced, one can ask, how do you possibly survive? And I want to hear what the answer is.
Sure.
And then there are some questions where Director General resigned, and there's questions about what about Hadassah's viability, not in terms of its work in medicine, but simply as an institution which needs money to survive. So would you give us, and further you should answer it to the extent to which you can, the concerns that were raised in the general media and the general Jewish community, but in general, give me a sense of where you feel Hadassah is now, both the challenges that face you, as well as anything that gives you optimism.
Thank you for asking that question, because I'm sure it's on people's minds. Hadassah has unfortunately had a cash flow deficit for a number of years in the magnitude that you describe. What has happened, though, are two things. First of all, we have entered into a historic, and when I say historic, that is really the word, agreement with the government of Israel, whereby it's really Hadassah, HWZOA, HMO, the hospital, and the government of Israel, where there are two things that are very important. First of all, there is a recovery plan that has been outlined in the agreement that all parties need to follow. And secondly, there is financial contributions made under that particular agreement. So while Hadassah has been, yes, in a cash flow deficit for a number of years, there are specific measures that are being taken, both financially and otherwise, operationally, and in terms of governance, to really revive the institution. So in governance, there is a new chairman of the board who is wonderful, and there's a new board, in fact.
Who's the chairman of the board?
Eretz Meltzer, who was a businessman, who is very highly regarded in Israel, who has taken over the board. There are 9 members of the board, a brand new board with people who are very, very well experienced in organizational management and medicine, and 4 come from the United States, 4 from Israel, and then the executive, the chairman of the board. So in governance, that is happening. In terms of financially, the government of Israel gave a historic contribution to Hadassah over a period of time till 2020, in which certain amounts of money are being contributed. HWZOA, Hadassah, the Women's Zionist Organization, simultaneously is making a contribution every year to a certain level to contribute to the implementation of the recovery plan itself. In addition to that, as Dr. Mishani has said, we provide funds for research per se. Part of the recovery is to put into place certain operational changes, certain medical changes. We do find that as a result, for example, of the changes that are made, that we've had more births at Hadassah, we've had more operations at Hadassah, we have more beds filled at Hadassah. So we see those as signs of a recovery. Whether we are there yet, we are not. And I wouldn't want to misrepresent it, we are not. But together, as those three entities, with the unions in many cases, we're working very much in coalition and cooperation to make the recovery plan work.
Were mistakes made?
Yes.
Are there mistakes that you can explain to us? Are there one or two which you say, this is representative of the problem which we are now addressing?
There were mistakes made in the way in which funds were allocated. There was mistakes made in the scheduling of doctors to practice in the mornings, their private practices, as opposed to doing operations. One of the biggest challenges we face, and this was a challenge that has not yet been addressed in the past or yet sufficiently, are what we call the sick funds in Israel. They're like our insurance, where we have not yet received the monies that are owed to us from the past and the money that we need now to continue to grow as an institution. Those were mistakes, and those are being addressed. Again, it is going to take time. It is still a work in progress, but it is something that we really have our eye on the ball.
And you're optimistic.
I'm optimistic.
Did you want to add something?
Yes. I'm coming from Hadassah. I was there last week. Unfortunately, the hospital is fully occupied. And there are patients coming every day to Hadassah. In the last first quarter of 2015, we were even. So we are doing very well in the last few months. And I think that the major problem that we have with the cash flow is because the sick funds owe us
Money.
big.
Yes, but at some point they catch up, don't they?
No, they don't have to.
They don't ever catch up?
Well, they still owe us money, and they owe us money for currently as well. So it's like double jeopardy.
Okay.
By the
Well,
way,
that's a real burden.
That is.
If they will pay what they owe us, we are not going to have any cash flow.
Okay, by the way, that's a
problems.
very important point to make. Incidentally, I want to ask both of you, and you're going to see it as an American Jew, you're going to see it as an Israeli. One of the criticisms of American medicine is that in America, medicine is a business. It's a business where people are in it to make money. Every end of it is about making money, whether it's the private doctor, whether it's the hospital, whether it's the drug manufacturer, whether it's the health insurance company. It's all about making money. And when people criticize American medicine, the American medical system, that's the criticism. And that ultimately, medicine and healthcare should be a public right, almost like a utility. It shouldn't be a business. And America is struggling with that, Eyal, that whole concept. I want to know how you feel. Medicine, the medical industry, and the healthcare industry is viewed and treated in Israel. Is it a similar problem? Is it a different problem?
So in the last years, it's also started to be a business. But again, I'm not a physician, but many of my colleagues are. And I'm telling you, they wake up in the morning and they see it as a mission. They go to work to treat patients. And I think that this is the main goal of what they are doing. Yes, there are some people or some physicians, also in Hadassah, but not only, who wake up in the morning and think differently, but they are minority.
You want to comment on
Yes, I do. I do want to say that every institution needs the funds to do its work. So there's nothing different in that regard. But Hadassah has a broader and a higher mission. And I don't want to be, a little over the top on this, but there are two things that I would want to share. One is that Hadassah takes cases that nobody else takes. Hadassah takes cases that other hospitals reject because they're too much of a risk, or because they can't get as much money for them, or because they don't know how to handle them. So in that regard, I think medical care is seen as something bigger and more important. The second thing I would want to share with you is that Hadassah takes everybody. You can have coming in on 2 simultaneous ambulances the victim of a terrorist and the terrorist himself or herself. And in that regard, it's not a matter of money for the institution. It's a matter of really saving lives, and saving lives regardless of who the person is and regardless of the background of the person. So I think while money is the thing you need in order to do it for Hadassah, I think it's clearly not the only motivator, and it's clearly not really the thing that sustains it as an exemplary institution.
Kol hakavod. That is beautifully said. Incidentally, I should have asked you as we were discussing the problems. You mentioned some of the reasons why Hadassah ended up with a cash shortfall. At the same time, was there ever a charge of ethical malfeasance on the part of those who were directing or leading or were in positions of responsibility at Hadassah?
There were charges of perhaps naive appropriation of funds within the hospital, but never ethical charges.
Which is very important to me. So people make mistakes, and by the way, sometimes people are careless. One should be held responsible in a responsible position if they are careless, but it's different than being a crook. And my understanding was it wasn't a matter of Hadassah somehow falling into the hands of crooks.
No.
But there was some mismanagement. Some
Mismanagement.
Mistakes. Okay. You also were hit by Bernie Madoff, were you not?
Yes.
Okay. When did you become CEO?
3 years ago, after Bernie Madoff.
Okay. So you have been brought in with the task to help rebuild.
Yes.
And I'm sure you had a vision as you first came in, and the vision was refined within a year, and it continues to be refined all the time. But if you had to judge now, if total solvency, there was even a little bit of in the black, and you could play with some more things. If that was the goal, how far along a scale of 1 to 100 are you on that goal?
Well, they say it takes 10 years to make change. I've been there 3 years, so I'd say 30% along the goal.
Well, good for you. You're right on target then.
But I do want to tell you what I think the goal is. And the goal is really to make the world really understand the value of Zionism, and that Hadassah Hospital is the best manifestation of that Zionist spirit that you can find. We were the ones who created modern medical health care in Israel. And we think that with no financial challenges, we could be contributing to the future of a whole new vision of healthcare in the future.
I think you're absolutely right. Everybody hears what you say, and I expect under your leadership you will get there. Both of you will get there. Yeah, both of you are outstanding. You touched on this, but I want you to elaborate. I had occasion to be in an Israeli hospital. I was struck by the extent to which the Jewish Israeli and the Arab Israeli, and the Arab in general, side by side, treated the same. I had Jewish nurses, I had Arab nurses. There are Jewish doctors, there are Arab doctors. But in that hospital, there seemed to be, and again, I'm not trying to over-romanticize, but that in general, there was no distinction of care given to a Jew or an Arab. You're in the hospital, and I'm not sure even was Israeli or non-Israeli. And to me, there is something striking about that says worlds about what the state of Israel is, which speaks to all of what I consider to be the wholly inappropriate criticism of the state of Israel when it comes to the Israeli-Palestinian conflict and how Israel treats the Arab-Israeli. But I would love either of you to comment on my experience that, in fact, in the Israeli hospital, the Arab Israeli, the Jewish Israeli, they're all Israeli. Eyal, do you know what I'm talking about?
Oh yeah, sure. You know, when I was the head of, or I'm still, but when I started in the cyclotron, when I was the director of the cyclotron radiochemistry facility, I had Arab students, Arab employees together with Jewish, and they work in harmony. They collaborate with each other, they helped each other, they were talking to each other and try to get as much as they can, you know, knowledge. And so, and it's the same with patient. When you enter the hospital, you don't ask who is Arab and who is Jews. You just do your job and do it together.
And you know, Hadassah was nominated for the Nobel Peace Prize because of what we call Bridges to Peace. Because not only do we serve all backgrounds equally, but we have trained Palestinian doctors to go back home. We have clinics in Palestine to help people in eye treatment, and clinics where we teach, you know, on the facility itself in Palestine. So I think you see a real desire through medicine to cure people and to ensure that their lives are extended. And I think that in Israel, and particularly at Hadassah, and I'm a little patriotic, as you can tell, I think that that really is an example of the way in which people behave.
I was so thrilled to have a chance to sit with you. You have touched on something that means something extraordinary to me, and I wanted you to know that.
Thank you.
And you get to make any comment you want, including none. But what's your comment to that?
Well, after what you said, none.
Okay. And your comment?
My comment is to thank you,
Well,
really, for how you feel, the way you express it, and your support.
Well, that's Kol Tuva Hatzlacha. From
Toda
strength
rabba.
to strength. Mazal Tov. Kol Tuva Hatzlacha. Only the
To you
best to
too.
you. I promise you, you're going to do wonderful things.
Thank you.
There will be a day here you'll be at 100%.
I hope.
And you'll come and
From
sit
your
here.
mouth to
and
God's
you'll
ears.
come and you'll sit here with me. Thank you.
Thank you.
It's been an honor and a privilege to sit with both of you.
For us, too.
Thank you. There you have it, my conversation with Dr. Eyal Mishani, Professor of Nuclear Medicine at Hadassah University Medical Center, and Janice Weinman, who is the CEO of Hadassah. And it was extraordinary to meet them and let them tell you their story. As always, I invite you to be in touch with me with any thoughts or comments you may have to anything you heard on this edition of L'Chaim. Please email me, write me, post on our Facebook page, or tweet me. I look forward to hearing from you. Until the next time, I'm Mark Golub. L'Chaim, my friends, to life.
L'Chaim is a presentation of Jewish education in media.
We would be pleased to send a complimentary DVD of this program to anyone who wishes to support JBS, the Jewish Broadcasting Service, with a tax-deductible gift of $36, double chai or more, to the nonprofit organization Jewish Education in Media. Simply visit the JBS homepage and click on the Donate button to make a donation by PayPal or your credit card. And please indicate the program for which you would like a DVD. Or you can send your tax-deductible check made out to GEM, Post Office Box 180, Riverdale Station, Bronx, New York 10471. And again, please remember to indicate which program you would like to receive with our compliments. And we thank you for your kind support.